titled Sharing Learning from SEND Improvement. I'm Deborah Glassbrook, and I have been involved in chairing improvement boards and the improvement journey for the last 2 years. And a very warm welcome also from Dame Christine Lenihan. She sends her warmest wishes, but also has to send her apologies, as unfortunately she hasn't been able to join us today. So a big thank you to all of you for making the time to come today to hear about the learning. And we are delighted that we are going to be joined by colleagues from Kent and from Hertfordshire who are going to share their learning in relation to the SEND improvement journeys that they have been on. I've got a copy of the agenda that was sent out, and thank you for CDC colleagues who have done all the preparation in relation to today. But just a reminder of what we're going to be covering today. I'm going to give a brief input around the context of SEND improvement following the introduction of the SEND and Alternative Provision Inspection Framework back in January 2023. Hertfordshire and Kent colleagues are going to talk about their improvement journey and the enablers of their success. And then we're going to have some question time and then an opportunity for you to go into breakout groups to think about what you're learning and what is working well for you in your areas. And then we will finish the wrap up of all those discussions and feedback at 12 noon. So just in terms of reminders, please, if we can go on to the next couple of slides, Thea, that would be wonderful. And the next one, just a couple of housekeeping points, please. This webinar is going to be recorded, so I hope that's okay with you all. It means that we can share it with others who've not been able to make it today, so that's really helpful. If we could remind you when you join, if you can put your mics onto mute, unless of course you're a speaker. I think all of us still do that sometimes, keep the mic on mute even when we're trying to speak. And if we could ask that when you do want to ask any questions, if you do come in for any reason, then please just introduce yourselves. But what we are asking is that you use the chat rather than raising your hands with questions, because actually I think there's about 153 people who've booked on this morning, which will mean there's probably far too many of us to be able to follow through on questions. Just a tips, if you are struggling to see the slides, if some of them are too small in terms of their font, please use the control and scroll your mouse arrow, and then it can make the content either bigger or smaller for you. So I hope that works well. And if you need any captions, then please select the 2 apostrophes in the top right and select Turn on Live Captions, and that should help you in that. So we're just going to move on then. Thea, you're going to tell us about the next national webinar, please.
Yeah, absolutely. Good morning, everyone. It's lovely to see you all. My name's Thea Walker. I'm one of the programme officers working at the Council for Disabled Children, and I work on the RISE programme. I just want to do a little bit of shameless self-promotion for some of our upcoming events and work that we've got going on. Just to say that our next national webinar, so we run 2 national webinars every year, the first one obviously being now. But the next one's going to be on the 5th of March, and it's going to be focusing on co-production and putting relationships at the heart of the system. The registrations haven't gone out for this one yet, but please do save the date, because I'm sure it's going to be a really popular event, and keep your eyes peeled for when that registration link comes out. And then our next national event, our last national event was in September, but the next one's going to be on the 6th of February. We haven't officially announced the theme just yet, but I'm sure there'll be more information coming out very soon about that. And again, please do keep your eyes peeled for any registration links. I just wanted to spend a little bit of time also talking about some further work that we've got going on in terms of supporting the SEND system workforce. So we've got a range of different support that we offer. I've obviously spoken about the national webinars and the national events already, but I just want to highlight our e-learning and our ongoing training sessions at the moment. as for e-learning, we've got before the end of the financial year, we'll have something on preparation for adulthood as well as sensory processing. We have found that sensory processing work has been really sort of in demand at the moment, so I'm sure that's going to be really popular when that comes out. And in terms of our training sessions, we've got a range of different training sessions coming up. So every single year we send out, as I'm sure you're aware, we send out the Send Workforce Survey, and we develop our training curriculum in response to that survey and the responses that we receive and those sort of key themes and needs that come out of that feedback. So we adapt the curriculum every single year. We would really encourage you to take a look at the various different trainings that we've got on offer and circulate the registration links with your colleagues. In just a moment, I'll pop the link into the chat. Just to say that you might need to go into the past events part of the calendar in order to find the links and the dates for some of those trainings. That's just because the start date has passed, but those trainings are still ongoing at the moment. And we'd really encourage you to take a look because it's a fantastic resource. And please do, yes, sign up for those, but also circulate the link amongst your colleagues as well. Deborah, I'll hand back to you.
Thank you very much, Thea. That was really very helpful. So the objectives of this morning's webinar is to provide information about the current special education needs and disability and alternative provision inspection outcomes and processes. We want to provide an opportunity for local areas, as we've said, both Hertfordshire and Kent, to reflect on their experiences in sharing learning, coming from some very different positions, which I'm sure they're going to describe to you, and then explore how the elements of the improvement relate to your area when we have the opportunity to have some breakout groups at the end of the presentations. So I'm going to start giving some context to where we are with the inspection outcomes and processes. On the next slide, please, Thea. I think what we all are probably aware of now is that there was a new inspection framework that was launched in January 2023, which included a greater focus on alternative provision and introduced 11 evaluation criteria, 6 specifically about children and 6 on leadership. And we are now in a position where we've got 49 inspections having taken place out of about 151, 152, 153, depending on how each of the local areas are being inspected, because as some of you all know, some local areas are joined together in multiple ways. So of those, we have 13 who have outcomes of what we are grandly calling a number 3, where there's widespread and or systemic failures. 12 who've got typically positive outcomes, and 20 have got inconsistent outcomes, and then the others who are awaiting outcomes. And as some of you all know, this is a rolling programme, and there are some regular updates on, if you look in LinkedIn or on the government website, about who is being inspected next. And last week there were another 4 announced. So it was through this inspection framework from January 2023 that those new judgments were identified. And I think it's fair to say that in terms of improving the focus on SEND, the inspection framework has certainly achieved that. Not always very positively for those people and those local areas that have been identified as widespread and or systemic failures. But I think everybody would agree that the SEND Code of Practice following the Children and Families Act of 2014 hadn't achieved what we all know and all would want to be achieved on behalf of children, young people and their families. And so this greater focus has been most welcome by the majority of people across the country. Now, what's really interesting is what happens, and the greatest focus for this morning is on what happens following the widespread and systemic failings in those 13 areas at the moment. So once the inspection report has been finalised, which is usually within about 30 days of the inspection and has been published, the local area, so that includes the 2 statutory partners, the council, the local authority, and health, need to come together to complete a priority action plan. Now, some of us are really encouraging and indeed pushing colleagues in the Department for Education to call that a priority impact plan, because we do believe that this needs to be about impact for the system, for children, young people and their families, rather than the over focus on actions. But that's something that is in progress and is part of ongoing conversations. So once a priority action plan has been completed, it has to be signed off by Ofsted and CQC. And the expectation is that that is completed within 35 days of the final inspection report being published. Now, what's happened since January 2023, and for most of those areas that have got widespread and or systemic failings, they have also received an improvement notice. Now, the only one that didn't was Nottinghamshire, which was actually the first local area system to have an inspection under the new framework, but all the rest have had improvement notices. And not only have some areas who've had the inspection framework, the newer inspection framework, had an improvement notice, but also several areas who had a written statement of action under the old framework. Now, what happens is an improvement notice, interestingly, is not a statutory notice, but it is a notice that is issued by the minister to the council, because currently there is no legislative or regulatory way of that being a joint notice for both health and the council. Having said that, the improvement notices do name the Integrated Care Board, the ICB, and anybody else or any other organisation they think it is pertinent to make a note of in the improvement notice. Now, those improvement notices to date have been for 12 months, and there's some ongoing conversation about that at the moment, because as part of the expectations requirements following the priority action plan being agreed, is some regular reviews during the first 6 months. After the first 6 months, there's a stock take, which is undertaken by DfE and NHS colleagues who are advisors to the area. And then there's a 12-month review of the improvement notice. Now, the difficulty with that is that Ofsted and CQC do a further visit at 18 months called a monitoring visit. And at the moment, the 12-month review of the improvement notice is out of kilter with the 18-month monitoring visit. And so there's some discussions ongoing at the moment about how to align some of the timings of those two different aspects of what happens following the inspection outcome. Of the improvement notices has come a determination that local areas need to have improvement boards and independent chairs. And I have been an independent chair, as indeed Christine Lenihan now, of a number of boards. Christine is currently chairing 3 boards, Hertfordshire, Oldham and Nottinghamshire, and I have been chairing the board in Herefordshire in the past, and Kent, Bury, and I'm now going to be chairing the Derbyshire board. And I've also been supporting a number of other boards. And what's really interesting about chairing SEND improvement boards is that when we first started, unlike in children's social care, there were really no tools. There was very little known about what good looks like, and very little known about what's going to make an efficient and effective board. So what we have done, there's a group of us as independent chairs, is set up what we've called a sharing and learning group, and we come together on a regular basis to talk about what's working well and what's not working so well in terms of improvement boards. And we have worked with colleagues from the Council for Disabled Children, sponsored and commissioned by the DfE, to develop SEND improvement board toolkits. And that first toolkit was signed off earlier this year, and we can make sure that those are sent out to you if you would like to see those. The first toolkit has 10 tools in it, and we are just about to start on phase 2 of an improvement toolkit, which is going to focus primarily on quality assurance and data sets, as well as looking at communication strategies and engagement and participation strategies. The first toolkit has what I'm sure many of you will consider very useful documents in terms of things like a job description for the chair of the independent the independent chair of the improvement board. It's got terms of reference, it's got an agenda, it's got an attendance list, it's got a document called Barriers to Success, which is an opportunity to work with everyone to look at what's worked well, what hasn't worked so well, and what needs to change in terms of the partnership particularly. And it's also got a report template and an evaluation document in it. And we've started using those across the country as a way of trying to encompass what's working really well in terms of board and how we need to develop that going on. So we are, as I say, working on Toolkit version 2. And if any of you are interested in being part of either of those, please do let us know. We're really interested in working with people across the nation about what you're finding is working well and some of the things that you're finding more difficult. And certainly when we get to the workshop element of today, again, you'll be able to put some notes of that in the chat. So that'd be really helpful. Thank you very much. So in terms, just to clarify, in terms of the improvement notices at the moment, they are still running for 12 months. We are hoping that that may well change to move to 18 months. And as some of you will know, the 18-month monitoring visits are currently on hold by Ofsted and CQC while we look at how all of that becomes aligned. So I'm going to stop there and check whether there are any particular questions that you'd like to ask about anything I've said so far, and before we move on to colleagues from Hertfordshire sharing their learning. Thea, is there anything that we've picked up in the chat that we'd like to pick up here?
I think we've just got a quick comment from Sam.
Sure. Sorry, Deborah, just to say the toolkits aren't quite published yet, but they will be very soon. So we'll try and update everyone on this, and we'll have them out on sort of LinkedIn, Twitter and things like that as soon as they do come out, but they're on their way.
Lovely. Thank you, Sam. Thank you for that clarification. Yes. Does anybody like to ask about anything of that? No? Okay, well, we can always come back to some other questions as we go through the next two presentations. So I'm going to hand over to colleagues from Hertfordshire then, please, to take us through their learning.
Thank you, Deborah. And hi there, Thea. I think Hero is just joining us from another meeting, and we'll make a start.
Thank you, Samantha.
Thea, can you see if Hero's on? If not, I'll start.
I'll just check.
Thank you.
It looks like she might still be in her other meeting, but I've just sent a request for her to join.
Oh, lovely. Okay. All right. Well, I without any further ado, I'll make a start. Thank you so much, and good morning, everybody. It's really, really lovely to be here in this CDC webinar, and we're sharing with you some of the work that we've done in Hertfordshire, with a particular focus on some of the things that we've learned, and I'm sure many of those will ring bells with so many of you involved in this this work. Next slide, please, Thea. So just a little bit around where we sort of started, I guess, and links directly into the update that we've just had from Deborah for Hertfordshire. We were one of those local authorities where it was found widespread and systemic failings. We had 2 priority actions and 5 areas of improvement that we needed to focus on and develop a priority action plan and an improvement plan to address really and tackle some of those areas that came out of our inspection. Thea, I think Hero's just joined, so I might hand back to Hero. Are you here?
I am, yes. Hi, Sam.
Yeah,
Hello,
great.
everyone. Good morning. Apologies for joining slightly later, but I think we were scheduled for 10:30, but it's great that you're running ahead of time. So thank you for having us. So Sam, are we just starting?
Yeah, literally just starting. Deborah's given a really helpful overview actually around the inspection framework, and I was just saying that we were on that bottom step really. So where we started was in the widespread and systemic failings. So I'll hand back to you. That's okay.
Fine. Yeah, no problem. So thank you. And I know Sam's introduced me. I'm the Director of Inclusion and Skills at Hertfordshire County Council. So SEND falls in my area of responsibility, as well as many other services, virtual school services for young people, educational psychology, statutory SEND and advisory services, as well as a service I'm really proud and pleased to have and would certainly recommend to anyone, our improvement and transformation service too, that Sam runs. So if we could click to the next slide, please. Okay, so yes, as Sam said, we were one of those lucky areas to be inspected in one of the first tranches. So I think we were the 14th local area to be inspected, the second county council. There is an emerging trend between poorer outcomes and sort of large population sizes, so county councils in particular being sort of affected in that way. So we're quite keen actually to kind of network as much as we can with people in that sort of similar position, both in terms of inspection outcome, but more actually in terms of size and population, because we're seeing that demographic really helps in terms of us being able to work together. So I know that Christy from Kent is presenting later on the agenda, and I know we link in fairly regularly, Christy, for those reasons. So in terms of our overview for our improvement work, this started before we were inspected, so there was certainly recognition and understanding from our leaders, particularly off the back end of us getting an outstanding rating at the ILACs and so for social care in January 23, that, you know, actually SEND wasn't at that same level, and why wasn't SEND at that same level. And we were in a good place in a way because of obviously that outstanding rating and the success of children's social care, to be able to really focus in on SEND and try to think about what we could emulate in terms of the success of children's social care in the SEND world. And I don't think that can be underestimated. Actually, I think there's a lot of kind of school of thought out there that it's very different, and absolutely, of course it is. But actually, in terms of systems and what works for children, really focusing in on what children need and the age, stage and needs that they have is very similar in terms of the children's social care principle that is applied very successfully in a number of areas, including Hertfordshire, can be applied to the world of SEND too. And we sort of took that as a bit of a blueprint to support us with that. So we're going to cover a few of these here today. So our Making SEND Everybody's Business programme and our SEND Academy, and then a few others as well that have come along actually more sort of post-inspection in terms of what inspectors saw and some of the improvements we've made in response. Next slide, please. So, as I said, off the back end in January 23, we were asked that wonderful question from our leaders: what would it take to get SEND to the level as children's social care in Hertfordshire? And I say it's a wonderful question because it's the fourth authority I've ever worked in, and I've never been asked that question for SEND. So it was a good place to actually be asked. And we didn't just say money, we did a really comprehensive analysis of what was needed for the system, really thinking about, as I say, the age, stage, phase of children, when those pressure points really come in, how we wanted to focus services, and also going back to our statutory duties, because that would be the biggest complaint we had coming back from parents was, you know, you're not fulfilling your statutory duties and this is not okay. And actually, I think we don't often do that because there was still a lot of debate, and there still is a lot of debate about whether those duties are achievable or not. But I don't think that should be a reason to not try to meet those statutory duties where we can. So it's really looking at that and taking it back to that and presenting to our leaders and our members what those statutory duties are, because I don't think a lot of the time people really recognise those bits, and why therefore there was so much anger out there in terms of not meeting that legislation, because parents can see this is what's in the law and you're not meeting it. And similarly with schools, when we're challenging schools to, you need to meet the law, if we're not, it puts you in a very difficult position in terms of that negotiation and how you move forward, because it feels very double standard from that perspective. So we did that. We presented a business case that showed the statutory duties, that thought about the children that we most kind of wanted to support, and we presented that to our leaders and to our members, and we were trying to really focus in on improved communication, improved timeliness and quality, particularly in relation to EHCPs, both new and existing, and real retention of our workforce, as that both recruitment and retention were real issues. Next slide, please. So this is what we came up with. So rather than having one statutory send team that was delivering all statutory send duties for 0 to 25, given that at this point we had, I think, 10,500 to 11,000 DHCPs, that's more like 12,700 now. We recognised that we needed to do something differently. And again, emulating what had been done in children's social care, we thought about the age and stage and requirements of the individual child. So now we have a range of services that deliver statutory send duties. They're existing services, with the exception of the school age one, which I'll talk about in a moment. All the rest are existing services. So if I take the example of the virtual school, they already provided outstanding support for our children looked after across the board, apart from when a child had an EHCP, and then it would be back to the send team to look at placement, to look at resource required to help them access that, to obviously write their EHCP and keep their EHCP, which was the central document for education, health and care, up to date. And they were getting frustrated, so even internally, with kind of the delays that were coming through. So it was about taking those statutory send duties and embedding them into teams that already knew their children. So our virtual school now do the creation and the review of EHCPs, they do the sourcing of placement, they have allocation from the high needs block, and they do that whole journey for those children. We have recently also undergone, from September, moving our children missing education and elective home education into the virtual school. So those statutory send duties are being delivered holistically by the virtual school, and it's helped us really define our most vulnerable children, because we define those now as those children without the protection or support or advocacy of a parent or a school as kind of our top priority. And in the virtual school, they have a much smaller caseload, so they have around 50 on their caseload. I always tell that story, back in, I think it was September 23, we had 20 officers that were delivering across the piece from sort of 11,000 EHCPs, and I'm sure you can do the maths in terms of the numbers there. It was just not sustainable for reviews. This is for the reviews of children. Now we've got a much more nuanced approach. So as I say, our most vulnerable have the smallest caseload, and that's because they need to do the additional work in the place of either a parent or school, and rightly so, to support those children. And then we've got a kind of range of services according to that. So the access and inclusion team supports children that are accessing alternative provisions, whether that's education otherwise than at school, or sort of approved support or some form of alternative provision. And again, those numbers are smaller. Similarly, the early years, I think the case was around 70 to 80, because again, they have to have 6 monthly reviews. It's that first transition into school that is really important. And then our school age service and our services for young people who support post-16 young people who are in further education, they have caseloads of around 180 to 200 depending. So they're much bigger, but they have those settings that they can build those relationships with. And we've got a whole sort of communications framework of how we work with schools and colleges and sort of training providers and so on, to enable them to deliver many of those statutory send duties and us to kind of support with that. So that was a sort of a nuanced way of delivering, recognising ideally everybody would have that sort of much smaller caseload, but obviously resource doesn't allow for that. So it's then creating a much more nuanced approach to delivering that. Next slide, please. So in terms of the investment that was secured, so there was 5 million prior to the inspection. It was actually announced during the inspection, the agreement, but it had been going through the various sign-off processes for quite a few months before then. And then a further 2 million was agreed after the inspection. So 7 million in total. 6 million of that went into the Making Send Everyone's Business programme. The rest was focusing on inclusion and new statutory attendance duties and the children missing education work that I referenced earlier. So we really we obviously then had sort of 138 staff to recruit via that, and prior, certainly in August 23, we'd gone out to recruit. I think we'd recruited, we put an advert out, we had 5 applications, we interviewed 3 people and no one was appointable, and that was how things were in the statutory send world for us. So we had to sort of turn things on its head, and we focused in on transferable skills and lived experience as a sort of prerequisite for staff coming. No other qualifications were necessary. And we held a recruitment event September 23. I think we had over 120 people come. We had stalls all around with our parent carer forums and young people, as well as all the different teams that would be taking on staff that I referenced before. So it felt like a sort of engaging sort of arena to work in, and people were very excited actually in the room in terms of the staff, which was wonderful because it was a new model and it had new energy behind it. And as I said, there was some really good conversations around the room with the sort of over 120 people, and people sort of left with strong energy. And we had over 900 applications into the programme, which was really good. Conducted over 200 interviews. And we recruited now the full 138 staff. 123 of those have gone through our Send Academy, because we recognised going out with that premise we needed to design our own comprehensive training and induction programme, which we did. That's multi-agency, and parents deliver on it as well as young people in schools, to really cover those kind of the broad skills that are required to be an EHC coordinator or somebody delivering statutory send and some of the other roles that we have. And you know, we've had a lot of interest in this across the country really, which has been amazing. So Sam and I went to the LGA. We were invited to present at the LGA Innovation at the conference a couple of months ago, or it was, yeah, I think a couple of months ago. And we've had kind of local interest as well in terms of press, and yeah, over 50% of our staff have lived experience, a number of parents. But actually, by far the majority have come from sort of education settings as well. So some of those have got both sets of experience, and some of them have got education experience or parental. Some of those with parental experience have come from a range of backgrounds, really. So it's been really interesting to kind of see and get to know them and talk to them. I think what cannot be underestimated is that real intrinsic motivation to do this work, which you need in terms of resilience, because it's tough. It can be really, really hard. You know, we don't have a magic wand for all this issue in the system, and that person needs to be able to hold that family or that school through that, which can be incredibly challenging. So I think really thinking about those underlying skills you need your staff to have and supporting them through that is what sort of underlay this whole programme to enable it to be successful, really. Next slide, please. And I've talked briefly about the Hertfordshire Send Academy. We're really proud of this initiative. It's emulated in other areas, particularly obviously social care, and Social Work Academy is well known, but there isn't that same consistency of programme or offer for statutory send. I mean, I know that Mason do deliver some really good high quality training for statutory send officers, as do Catswood Disabled Children and others. But I do think having it all in one place that was localised as well in terms of across the partnership for education, health and care, and hearing from our parents and our young people really helped. Having said that, we are looking at ways to kind of spread this even further. So now we're in a place where we're expanding it out to train some staff in schools and health professionals and others, and potentially to work with other areas too. So it's a really exciting piece of work, and it's got a lot of real attention really, and we're very proud of it. Next slide, please. Okay, I think I'm handing to
Yes, you are. Yeah, thank you, Hero. And yeah, we are really proud of the Send Academy. We've had some really good feedback from staff as well that have taken part in that, and it is the majority of our staff, not just those that are new into the business, but also those that are existing. We're wanting to make sure we take everybody with us, and that they all have the sort of skill set that we need. We did, as part of that sort of workforce piece, we recently did a staff pulse survey as well, so worth referencing here. Some of the feedback, we got really high engagement from the staff pulse survey, and sort of some of the positive, I mean, it was broadly positive, but some really positive pieces, certainly in terms of commitment to Hertfordshire, feeling supported in terms of the training that they've had, and sort of management support is coming through that survey. So that's great. We had our old problem was, how are we going to get this level of staff to support us in Hertfordshire? Our new problem is how we're gonna keep and retain those staff. So it is a welcome problem from our perspective, given where we were a year or so ago. So moving on into some of the other areas of work that we've sort of focused on, as well as the new delivery model in the Making Send Everybody's Business programme, really taking sort of quality assurance seriously. So my background is safeguarding and child protection before I came into Hertfordshire, and I remember coming in and asking to meet the quality assurance team, of which there was one person. So I think that became quite a clear area that we needed to focus in on. So we really built sort of the capacity in the QA team, as well as introducing practice development leads that are able to support our sort of QA leads and those lead auditors and others in really driving through those sort of practice improvements across the rest of the business. That's working really well. We've also, as part of that, then developed a quality assurance framework right across the partnership, and stood up a quality assurance board, which is a really strong partnership board, really well attended. And initially there was a focus, quite rightly, on the quality of the HCPs. We knew for us in Hertfordshire that was a real sort of key area. So we started off there in terms of the level of audit that we did, but actually we've really broadened that out to look at quality across the pathway for children and young people, and that enables us to bring partners with us. So there's been quite a big number of quality visits, for example, in hospitals, looking at the support for Send young people as part of that offer, and a range of other bits and pieces. Yes, we've got parent carer representation that sit on that quality assurance board too, and indeed they support and help with audit activity and a range of other bits and pieces there. So it really is a sort of a partnership wide piece, and I think we've sort of drawn it from something that happens in a corner to being something that underpins all of the work that we do. And linked to the Send Academy, that sort of learning feeds into updates on modules, or the specific pitch and tone and content of training delivery, so that we're able to close the loop from that sort of training perspective. Next slide, please, Thea. Another area of work for us was the voices piece. So I think we knew prior to the inspection that we had much more work to do in terms of voices of children and young people. We've got a really vibrant parent carer forum, HPCI, that support us in terms of drawing together voices and experiences from parent carers. But actually there was not enough from our children and young people. So we've done a lot of work in this area. We started really through funding to identify one particular role. So I think part of the learning for us is, yes, people can do it as an aside to what they're doing, but you do need someone to take a leadership role around this area if you want to take it seriously. And the pace that she's been able to develop a voice framework for us at the strategic level down into sort of operational delivery has been something that we're also really proud of. So that's included the co-production of the This Is Me form that really enables those views and voices to be heard as part of the EHCP process. That's been co-designed with some of our young people. We've also got a range of Send focused youth councils that we as a senior leadership team are also embedded in. So we will always go and be present there, but also have the those voices kind of come back through to us. And of course, embedded in our partnership assurance board and a range of our other work streams. It was lovely. We had at the last partnership assurance board, we had our experts by experience presenting, but actually even before that, we opened with a video of some of our young people, even the little dots, who were lovely. And actually they just had a message, a very simple message for us, which is, you're here because of me. And that really set the tone, I think, at the last partnership board, where we were all reminded in the room as to exactly why we were there. And as it says there, also the experts by experience, who are amazing. And we're very, very lucky to have them in Hertfordshire. They're involved in a range of work. I think within the first few weeks of appointing them, they had a full work programme for the rest of the year. So they're highly sought after. And we've also stood up some reverse mentoring. So they are all linked into our directors. And once a month, they meet with those directors to talk about things that are important to them. And actually some really interesting work is coming back from there. And we heard some feedback from one of our experts by experience that felt he had a direct dial line to those strategic decision makers, which really, really made him feel sort of empowered in a way that wasn't possible before. So that's been working really well too. Next slide, Thea. And just some of those examples there that I referenced from the voice framework. So sort of links into the Voices of Hertfordshire sort of framework, but also then involved in training, the autism training. We've had young people go out to be part of the specialist provision building review in terms of what space should look like. Co-production on a range of the surveys to ensure that we're listening in the right way and we're asking the right questions. A whole host of co-production in sort of some of the tools and approaches that we've got here, and linked into the DCO network as well. So right across the board, not just in statutory SEND, but right across that sort of full partnership. Thanks, Thea. Next slide, please. So as well as that, we knew before the inspection, but absolutely heard loud and clear through the inspection, the communication was not good enough, and we knew that. And actually part of the approach to the recruitment that we took was wanting to make sure that we had that sort of much more empathetic and understanding tone around our communications, which is what we'd heard from families, actually, that it felt very process driven, and there wasn't the recognition of their situation and some of the experiences that they've had. So we launched and developed a communications framework, led really through our parent carer forum, who devised that acronym, accurate, compassionate, timely, which really powerful actually, because we need to do all three of those things, and actually we need to act on that, I think, fundamentally around the communication, and be much more sort of timely in the way that we communicate. So we're currently rolling that out across the partnership, including some of the sort of protocols, communication protocols and procedures that we've got in terms of bedding that down. But that really is becoming the mantra and the ethos around the way that we communicate in Hertfordshire. And that has its own distinct training module as part of the SEND Academy too. And you'll see on the right there, we've had the logo designed by one of our 8 SEND young apprentices as well, which is lovely. He's really, really proud of that. He had a meeting with our executive director only a couple of weeks ago, and I think she'd said he mentioned it 3 or 4 times in that meeting. So I think it meant a lot to him, and of course means a great deal to us. Thank you, Thea. Next slide. I'm going to hand back over to Hero after this slide, just to share some of the impact. But I think the other bit of work that we're really proud of, and it's really important, but I suppose it can be seen as slightly dry, is our data dashboard, which really underpins how we have that sort of oversight right across the partnership around data and intelligence and insight. And I think when I joined, we were data rich, but probably insight poor. We weren't extracting the insights and the meaning from the data across a partnership in the way that we wanted to. So we've done lots of work within my sort of data and insight team that sit within my service, but also connecting into other data leads across the rest of the system, thinking about sort of health, data intelligence leads, public health, thinking about sort of JSNA work, and a whole host of others to sort of draw up data in a meaningful way. And alongside that, we've developed a sort of data framework, which means that we're able to have a really consistent way of agreeing how we escalate concerns around data. Because it's great that everybody looks at the data, but actually we need to be really clear on what it is it's telling us and when we need to act as a partnership. So it really does drive and inform many of the discussions we have at partnership board, and of course all of those work streams that sit underneath that. So that's another piece of work that we've been doing along the way. Hero, I think over to you for a few slides on impact.
Yeah, and can I just say thank you so much. I'm just aware we've got 3 minutes left for this section, please, Hero, if that's okay with you. Thank you so much.
No worries at all. 3 minutes is perfect. So it's just 3 slides left. So just very briefly, as Sam said, on impact, which is always important. So the so what, we've put a lot of these initiatives in place, but we're really keen to kind of measure that. And that's one of the successes actually around the quality assurance framework in particular, is that we've got a record of audits. We are actually implementing it, and certainly from our recent DFE stock take and NHS stock take, they were really clear. Often QA frameworks are created and then sort of popped on a shelf, but actually yours is being used, it's being implemented, that cycle is being completed in terms of continuous improvement to services, and partnership is looking at it. So we've managed to kind of implement it, embed it. These are some of the kind of the obvious markers that you would look at, sort of parental experience. For the first time ever last quarter, we had we had more compliments than complaints, which was great into statutory send, because obviously that is a challenge. So we still have a lot of feedback. Don't get me wrong, we haven't cracked it all. So there are numbers of complaints coming through, because obviously there are pieces that are bigger for us to tackle around sort of special school provision and other things. But the sort of framework and the building blocks are there in terms of that communication, and people are really valuing it, and we're getting a lot of positive feedback from schools and parents around this. We've also continued to see a real rise though in the numbers of requests coming through. So we've actually completed 28% more EHCPs this year than last year because of that rise. So if we hadn't seen that, we'd be over 80% now in terms of timeliness on 20 weeks, but that's sort of just under 60%, which was our milestone for this year, which is still improved on last year, which was 40%. The next slide, just very briefly, also just focuses in on that quality piece, which is really important. We are auditing our EHCPs in terms of their ratings. We're looking at the best way to do that going forward, because we're finding it's very particular sections that we're kind of having to put in that additional training in around and so on. But we are sort of more in line with a kind of national benchmarking of around 40% good for the particular tool that we're using, which has worked with over a third of local authorities. So again, starting from a very low baseline when we first started using this tool about a year ago, 5% good or better. That's showing that impact and that improvement that some of this work is having. So we're continuing to sort of track that as closely as we can. So a lot of evidence of impact, which we're proud of. And the final slide just shows you the enablers for success so far. Thanks, Deborah.
Hero, Samantha, that was absolutely stimulating, fascinating, lots of questions, but fantastic to hear about all those amazing things that you've been working on and what you've achieved. So thank you hugely for that. Just to answer the questions, I know people want these slides. Absolutely, we'll be sharing the slides, I know, and we'll have an opportunity for some more questions and answers after we've heard from Kent. So thank you again to both of you. We're going to take a couple of minutes break now and come back at 5:02 if we can, please, just so there's a bit of a comfort break, and then we're going to hand over to colleagues from Kent, Christine and Abigail when we come back. So thank you very much. We'll see you very shortly.
Thank you.
Cool. Well, I hope most of you are back. It is 10:55, so we're going to make a start. And I'm delighted to introduce Christine and Abby from Kent, who are going to share their learning with us. Thank you very much, Christine and Abby.
Thank you and good morning, everybody. Thanks for the opportunity to present at the meeting. So I'm going to kick off and then hand over to Abby later on. So the first thing to say, it was interesting to see the commonalities with the previous presentation. The way we've approached it is a bit different, and there's quite a lot of, certainly in my bit, personal view, I suppose, and analysis. Okay, first slide, please. Okay, so just a high-level timeline of what happened. If you look at the Kent data, in 2018, we started to deviate from what was happening nationally. And then the first area inspection, 2019, 9 areas of weakness. I mean, it's a really, really damning report. And as a consequence of that, KCC decided to establish a SEND division. So SEND was then kind of siloed and started developing all of its own processes, including around admissions. Kent got itself into some very serious financial trouble. So we were invited to join the safety valve. And at that point, our accumulated deficit was about 150 million. So quite significant, and the safety valve was agreed. So we had all of that going on with that governance structure. And then in September 2022, the second revisit, as it was, but obviously it's an inspection, insufficient progress against all 9 areas, and inspectors actually said that they thought there was a possible deterioration from the last inspection. So Kent had got itself into a real pickle. The workforce was totally demoralised, and we've got a workforce of about 400 in the actual SEND bit. We had over 100 vacancies. And the culture was absolutely toxic. And so the DCS made the decision to ask HR to do a cultural review, and the report was absolutely shocking. And there were 2 kind of views there. We're okay, we're doing everything right, go away and leave us alone. And then the other one was, we're being blamed by everybody and it's not our fault. So there wasn't even an acknowledgement of the kind of workforce role in what was going on at the time. And so we started planning around some cultural development work. Then SIAB was set up, our SEND Improvement and Assurance Board, with Deborah chairing it, and the reporting structures were set up in January. March, the improvement notice was issued, and on the 1st of April, SEN came over to me as Director of Education, and we created the Education and SEN division. Started the cultural change programme. We spoke with staff in September 2023, brought them all together, and we launched our 3C programme, which was a competent, consistent, communicating staff. I was interested to hear there was 1 QA person. In Kent, there were none. There was no QA within SEND at all. And again, we adopted a social care model and sort of tweaked that further. So reviewing everything, that was feeding into the training programme. But we wanted staff to feel personal accountability. And so this is where the cultural development programme was really helpful, because it helped us to create a story. We used an image from the boy, the horse, the mole and the fox, which is the first image in that book, actually. And it's a mole saying, "I'm very small," and the boy says, "Yes, but you make a big difference," because we really wanted staff to feel that level of accountability. My slides have disappeared. I don't know what's happened there. Okay. So in August of this year, the improvement notice was lifted, which we're really pleased about. And what's happening at the moment is that we're evolving our governance and reporting, because our last inspection was under the old framework. And so obviously we're preparing for another inspection under a new framework. So we've been managing those kind of tensions in the system. Our next assessment is in January. Okay, next slide, please. Oh, there should be one before that. Yeah, no, one after that one. Yeah, that's it. Great. Okay, so I'm not going to go through all of the change programme because it is absolutely enormous, but we're reviewing the continuum of education and school provision. We're just establishing communities of schools, huge pieces of work around our decision making. I've mentioned the workforce, a lot of work on communication. Next slide, please. Okay, so what makes a difference? And I'm not going to talk about all of these. I've just picked out a couple. Political support. We've got a fantastic cabinet member who is absolutely determined to drive change through and is very challenging and supportive. Clear decision making, I'm going to talk about in the next slide. I think one of the roles of SIAB where it was really effective was bringing together of the SEND system round one table, which enabled us to form really strong professional relationships. Driving accountability, and I think SIAB and the governance around the safety valve has really helped us with that. My view is, and it might be different in other local authorities, there isn't enough accountability in the system, particularly around the use of money. And we've got a strong evidence base around that. That's probably another presentation, so I won't go into that. Prioritising and being really ruthless about it. I'll talk about that in a minute. Investing in the workforce. Communication, really a lot of investment in that, and a whole system response. So we've had a lot of support from the corporate centre in Kent. The chief executive has really taken an interest in this. So we've been held to account, not just by through the safety valve, SIAB, but internally as well by the corporate board and by cabinet. Next slide, please. Okay, so I'm going to say something about decision making, because there were loads of decisions to make, and there still are. And what I found and my team found helpful was to have some very clear principles to underpin our decision making. Now, and I'm not going to go into this in any detail, but that response of Kent to other SEND, I think, is incredibly damaging. We've taken the approach that a child is a child, and that's why we've really welcomed SEND coming into education, because children who have got additional needs and they might have an EHCP and so on, first of all, for a lot of them, it's a permeable barrier that you can't just corral them into a different group and shove them somewhere else. A child is a child, and I think that's a really, really important underlying principle. They're not a child for long, so there's something about having your eye on the end game and then transitioning to adulthood, because most children who've got SEND will spend the majority of their life as adults. And what are you aspiring for? And what we've found is a lot of the decision making in SEND by services and by parents is really focused on the here and now, rather than thinking, is this the best choice in terms of our responsibilities to prepare this child for adulthood? And often they're not very good choices. And I think there's a kind of dimension here that comes into a parental right to choose a school if their child has got an EHCP. I think it skews the system. But that is another whole debate. But that's the kind of principle we've adopted. The cake is a cake. There are finite resources. And this is something that we keep saying, rather than lobbying for more money. We've got huge amounts of money and resource in the Kent system. So the DSG is I can't remember exactly, but it's about 350 million a year. That's a lot of money. I know we've got a lot of children, but that's an awful lot of money, and we're overspending it. So we're not in the business of keep lobbying for more money. We're in the business of focusing on what we've got and making sure there's best use of it. And I can't say that is the case at the moment. We're getting better. The job is the job. What is our job? So we've spent time kind of reflecting and talking on that. Essentially, we are gatekeepers for limited resources. And that goes back to, that's a really important principle. We can't do everything that we want to do. We can't do everything that everybody else wants us to do. So what's fair for everybody is to have open and transparent decision making. So the resources we have got are fairly distributed. Evidence is the evidence. There's a lot of, I think, focus on what people feel and think, and that's important, but so is the numerical data. So we have lots of mechanisms in place where we build up a rich picture of what is going on, looking at the numerical data and the qualitative data as well. But again, I think in SEND that there's a risk that the qualitative overrides the quantitative, and I think it's important to have a balance there. Behaviours are key, they have to change, and that's really been the focus of our staff development programme, and where the cultural work with HR has helped us. It's been focused on what behaviours have to change, what do good behaviours look like, and how do leaders model that. And you're not going to get change in a system as big as Kent's unless you can have confidence that your staff are behaving appropriately. And then there's something about the realpolitik and being very careful about timing when you do things. Trump's has got a capital T on purpose, because there is something about perception and reality. And one of the challenges we've got at the moment is the perception is still that Kent is, to use the words of a blogger that we've got in Kent, Peter Reid, beleaguered. We're not. We're in a really good place, actually, in lots of ways. Next slide, please. Okay, for me, I had to take a masterclass in saying no. So really ruthless prioritization. And, with all of the governance and the boards and everything, people say, well, why don't you do something about this? Why don't you? Often it was about annual reviews, but we were absolutely focused on getting the EHCP's process right. And with 9 areas of weakness, it's very easy to spread yourself too thin and not have any impact anywhere. So a lot of my job came boiled down to saying no to a lot of people, and that was really working closely with colleagues in health and my leadership team to be clear about where could we have the most impact. Investing in the workforce, I'm not going to say any more about that now. And communication, really, and we're working on this all the time, reframing the narrative so that it's realistic and reflective of what is going on. Next slide, please. Right, evidence of impact. So I'm going to share some data and then pass on to Abby, who's going to go through some case studies. So EHCPs issued in 20 weeks. In August 2023, we had 2.7%. By September, that had gone up to 10.8. In October, we hit 77%. It's probably going to be higher for November. We haven't got the end of month data yet, so I didn't want to share that yet. In terms of quality, we've got 4 different quality assurance strands around our EHCPs, one of which is the DFE. We meet monthly with the DFE and they take a sample of EHCPs and look at them and will grade them. And that last exercise took place last week, and 5 out of the 6 that they looked at were good or better. So that equates to 86%. Now, we've had some issues raised about us rushing them through, and there's some truth in that. I mean, that's a tension that we've got to manage, is the QA against actually how many we get completed in deadlines. So we're looking at that. Again, what I can safely say is the general quality of EHCPs is just nowhere near what it used to be. So it's much better. So really pleased about that. Annual review completion has gone from 38.6 to around 65%. Again, pleased about that, but looking to improve it. Our decision making, I made reference to our work on reviewing that. So our average in 2023 was 63% yes to assess, and in the first part of this year it's gone down to 41, and I have to say we haven't seen a disproportionate increase in appeals against that. So from January 22nd, when we introduced our changes, through to the end of September, we had about 600 fewer children in the system than we would have done had we not changed our decision making. And then the next step in that, it was 91% yes to issue, which has gone down to 80%. Yeah. Okay, so that gives you an overview. I'm going to hand over to my colleague Abby Kitt, who's going to take you through some case studies with evidence of it. Oh, I think I've got one more actually. Sorry. Next slide. Yes.
Just to let you know, there's just 5 minutes left, please.
Okay, so this gives you evidence of impact of our cultural development programme when we spoke with staff in September of this year. Okay, Abby, over to you.
Okay, I'll go as fast as I can, because actually you've got the slides, so you can look at those. But drawing through the theme, a child is a child. So in Kent, we have around 350,000 children. And in the NHS, we don't have SEND services. We have children's services, and we don't distinguish, and particularly in data, particularly whether a child is identified as SEND or not, because we provide services irrespective of the cohort of children. We have very few jobs. In fact, I was amazed when we recently had a massive joint conference, as we regularly do now, with how many SEND officers there are, for example. And actually, we have very few jobs in the NHS with the title of SEND in the job. We have children's services. We also have very few leavers within the NHS, very few points for prizes, and very few metrics, well, no metrics for a ICB, an integrated care board, of which I work for in Kent and Medway. So no measures that are SEND specific, and in fact I've put them in the chat just in case of interest. However, what we do have is a statutory duty, and we now have, over the last few years, the ICS approach, an integrated care system approach, and that is really significant and really important to SEND. We also, had a joint inspection which was extremely poor at the time, and we had significant challenges around therapies and mental health, particularly not mental health particularly, but therapies, waiting times at the time that we had our inspections. What we do have is well established, trusted, and that's becoming even more important as the system is more and more challenged, relationships between our stakeholders and organisation. And what we were particularly sad about when we had our re-inspection was that joint commissioning was still deemed as not being sufficient enough, because actually we feel that across Kent that is a strength, because we've had a joint commissioning relationship for a long time. However, saying that, what we clearly did not draw out enough at the time was impact. It's all very well having as good trusted relationships with very good commissioning alignment, and I say alignment because actually not every approach is about the end product being a joint contract. There are many other ways of having aligned commissioning with a joint goal than just one conduit to a contract. And so I think nationally we need to change that language from joint commissioning to aligned commissioning. So that is the context we're working in. And therefore, that alignment of commissioning, that alignment of our organisations with common goals, fired by very poor inspection, etc., has led to us recognising collectively and having the environmental opportunity that none of these nuts can be cracked in independent organisations, that you have to work collaboratively to deal with speech and language, neurodiversity, mental health. And I've given 3 examples in the pack, and I will just draw out, because I know that we're tight on time, a couple of key things. One thing to say about the 3 examples I've provided is we do have quite a grown-up, mature approach to for each of these 3 areas. The work we've done is all of them are underpinned by co-production and children and young people's voice. We have joint posts across our organisations to enable that. So there's those 3 examples I've given in the pack. None of what has been achieved has been created and done and developed without children and young people, and we can evidence all that. And the upshot of that in your pack, there's 3 examples. I would say our ND example is potentially the least mature but the most difficult nut to crack, and that's not acknowledged nationally, and the only way to do it as a system working with our schools. And I'm not even going to draw out particularly, because we've already heard about This Is Me, and we've also heard about pins, but these are increasingly the things that we're putting in to recognise that an assessment doesn't meet a child's needs. So what we are seeing in Kent is the early evidence, and I haven't put it here, but our referrals are beginning to go down. So our waiting lists continue to go up. They do. And I'm sure that's the same for many areas. But our referrals are beginning to go down. And that is an early indicator that increasingly families are not feeling the need to reach out to specialist services, because they are getting that support earlier. And not feeling the desperation in then feeling sitting on a waiting list is the way to go. The other example, the most mature, is our approach to mental health, where currently we have our latest data, and it's in your pack. Only 64 children are now waiting over 18 weeks from referral to treatment. So recently at a conference, I asked that all Senkos, feel that they can refer, because of course nationally they hear the waiting times are terrible, and they hear it on the news, and of course actually that's not always the case. And the important thing is, please refer the children that need the support. And we've got 92% of our children waiting under 18 weeks from referral to treatment. For speech and language, just one final thing, we are operationalizing the balance system model, and already, even though I say it's been going for about 4 years, but it is now really starting to take hold across the whole of Kent. And so actually in Kent, we only have 164 children waiting over 12 weeks, but that actually 118 is just one final district that we haven't rolled out to. So if we took that district out and we have 12 districts, then actually only 50 children. By this time next year, we won't have children waiting over 18 weeks. The model is very different. So waiting times is not the best indicator for families feeling supported. What is a better indicator is actually our referrals are going up quite significantly. And the point around that is our families are getting seen and supported earlier. They're getting interventions earlier. So our talk-in, walk-ins, final point, that is part of the balance system model, we are seeing more and more families being able to bring their children in, being assessed there and then, and supporting the families to support their children, tooling up families themselves, and we are tooling up the schools to provide support, and we have link therapists going into schools. So just as one little nugget right at the bottom of this slide, this is a talking walking where they had 148 responding to a survey. Every person gets a survey when they attend a talking walking. At the beginning of those respondents, 40% were concerned or very concerned about their child's communication. With that intervention, that was reduced down to 7% of the families were feeling concerned, very concerned. Direct impact from a very simple change in our approach to very early identification and assessment of children. That's it in a nutshell. I hope that was helpful.
Thank you both very much indeed. Yeah, and incredibly helpful. Thank you for your very open and honest reflections there on your journey, and great to hear about those 3 examples of impact. And I think really interesting, as you noted, Christine, at the beginning, the commonality between the 2 areas is really stark. And I think what was also really interesting is that pulling out of the political and senior leadership engagement and sense of accountability. And I know, Hero, and you would say the same, I'm sure, from Hertfordshire's perspective. That's been really important to have the political buy-in, but also the chief exec and everybody else at that more senior level. So really important there. Thank you very much indeed. So we've got 10 minutes now for questions about both of those very, very helpful and insightful presentations. So Sam, have you got some questions to share with us, please?
Hi, Christine. My Wi-Fi is back on now, so we have had some questions coming in through the chat. A couple of questions for Hertfordshire. One was just around the funding to the Parent Carer Forum, around their involvement in this work.
Yes, I mean, we already had a sort of resourced Parent Carer Forum, so we didn't have any additional resources allocated through this programme. What we did focus on, which Sam obviously talked about, is the engagement of young people, particularly, because that's where we needed to really put that additional focus and resource into. We had a strong partnership with parents all the way through, and that continues.
Excellent. And we did have another question just about sharing a copy of the This Is Me form. There's a link in the presentation. I've shared that in the chat, but are you able to share a copy of it as well, just so that we can send it out to attendees?
I mean, the link has a copy of it, so I think we've done the right thing here. Yeah.
Okay. Perfect. And we've had a few questions coming in for Kent. Amanda was asking about whether you're applying the Devon ruling to annual review timescales.
Sorry, you're going to have to tell me what that is.
Amanda, do you want to come in?
It's the 12
Sorry, can you hear me?
Oh, she can hear you.
Yeah. So the Devon ruling was where it's some case law where so initially we had in the code of practice, didn't we, that the annual review comes in from school for 2 days. Local authority should send out a letter saying whether they're going to amend or not, and then amend as soon as possible. It was then taken to court in Devon, and there was a Devon ruling saying that the code of practice had been misunderstood really helpfully, and that when we send out the letter to say whether we're amending, we should send out the notice of amends as well, which is within 4 weeks of the annual review. So we've now got parents LGOing us because they're not getting their notice of amends within 4 weeks. So we've implemented a system to make sure they are going out within 4 weeks, and we're getting there. I just wondered whether you were working to that and the 4 weeks.
So we do follow that wherever possible. Yeah.
Excellent. And we've had another question come in from Ebony, and she was wondering whether Kent has been working directly with or talking to any of the schools who are part of the Nurturing Kent programme.
We have really high levels of engagement with schools through all our changes. Everything is co-constructed. So we've got, we invested in Nurture UK, and we've got 50% of the schools who are either already accredited or on the way to accreditation. So we do listen to them, not as a discrete group though, but they are involved in focus groups. We've got working groups. We've got all kinds of stuff going on. So they're involved in that and shaping what we do. We had a huge investment in training, and Nurture UK was one of the strands. At the moment, we've got a 3-year contract with the Autism Education Trust, which is now in its 3rd year of rollout of training across the county.
Excellent. And it looks like we've got a question for both Hertfordshire and Kent from Harpreet. They were wondering, so they'd like to know a bit more about your QA processes and the team structures within your SEND teams, particularly around how decisions are made for decisions to assess and decisions to issue. So i.e., are they made at a multidisciplinary panel? If so, at what week, or whether they are potentially made outside of the panel?
Yeah, I'm happy to come in because I'll have to leave after this question, or probably there's one more I can probably stay for. But we had a big review of this as part of the kind of investment and the new roles that were brought in. So we created 4 additional positions for sort of the geographical quadrants in Hertfordshire, our SEND panel leads, and they are sort of experienced statutory SEND professionals, but their whole focus is on chairing sort of from an independent perspective. So they're not attached to any of our sort of operational services, but they chair the panels for EHC needs assessment, decision to issue a plan, and also provision panels. So this means we've managed to increase the frequency by 8 times as many, which is important because it enables that problem solving, that discussion, that frequency of decision to be made. But alongside this work, we've also sort of had an independent review into our EHC needs assessment process and implemented some of those changes into that panel. And we're also just completed the special school review, and that will also inform kind of the decision making going forward. So it's increased capacity really for that decision making purpose rather than an add-on for our staff, and kind of ongoing review really into the what works in terms of those principles. The biggest challenge we're facing is the increased sort of levels of requests. We're actually slightly below national for a percentage with the HCP, so that's a challenge for us in terms of being able to hold the line in that way, given the increase of need that we're seeing. And then obviously special school placements, making sure we get sort of the most complex children into our special schools.
Lovely, thank you, Hera. Have we got any more questions, Thea?
Did they want a view from Kent on that one as well? Sorry, Deborah. Okay, so our starting point is really different because we've got way above the national average of children and people with the HCPs, and we've got more than 20,000 in the system, which kind of gives you a bit of perspective when we're talking about annual reviews. In terms of quality assurance, we have got 4 strands to that. So we've got a QA and professional development team that they're together, so they undertake auditing, including multi-agency auditing and involving our parent and carer forum. Then I've made mention of the DFE quality assuring. We commission Envision 360 to do some QA of plans, and we've got a team of serving leaders in the Kent system who work with us on a sort of consultancy basis. We call them our inclusion champions. So they've been in and kind of observed and done training and modelling as well around the decision-making process there. So we think we've got very robust process now. So if it goes through the process and we think it might be a yes. There's a sort of triage system. So it's the potential yeses that go to panel. So if we're considering a yes to assess or issue, then those would go to a panel looked at by EPS and managers, and a final ratification from staff who've got school experience. We've been successful at refusal to assess in tribunal, particularly when the schools say they can meet need within ordinarily available resources. And that whole process is moderated. So I was looking at the tribunal data last week. I think it's 90% nationally are upheld. In Kent, we're about 87% upheld. We haven't actually done any work on the tribunal service, so we're pretty pleased with that as a starting point and think that's a kind of evidence of the robustness of our systems.
Wonderful. Thank you very much. So I'm just aware that we're at time for moving on to the breakout group discussions. So if anybody's got any final questions, I think we'll pull those forward. Thea, is there anything final you just wanted to say at that point?
There are a few more questions coming through, but Christine, Abigail, Hero, are you happy for us to email those on to you for any further responses?
Yeah, wonderful. Thank you. That would be incredibly helpful. So can I just say thank you again, Hero? I know that you need to leave now. We're really very grateful for all your insights and sharing this morning. Thank you very much to you and to Sam. And we look forward to hearing how Hertfordshire is going over these next few weeks as you move through from your improvement notice, hopefully monitoring visits and everything else very soon. We wish you all the very best with that. So we are going to move into the group discussion. So there's 15 minutes for you, and CDC colleagues will put you into groups. The questions are about how you are ensuring partnership arrangements are strong and impactful, and what would help you to do that better. And please, could you identify 3 elements that you could feed back after the 15-minute breakout group. So thank you very much for engaging in that. Hope you'll find that very helpful. And I'm going to leave it with Thea and Sam to put you into those groups now. Thank you.
Excellent. Just give me one moment and I'll make sure that we open up those rooms for everyone. The breakout rooms should be opening now and you should be getting an invite to join. I'll be staying here, so if anyone doesn't get the invite, I'll be around to help out with any tech problems. Hi everyone. Sorry, Deborah, I couldn't remember if you wanted to be assigned to a room or not, so I think you're on mute, sorry.
No, I'm quite happy not to be in a group, thank you.
Sorry,
Natasha's here. Natasha and Claire aren't in a group yet. Theo, are you able, or Bridget?
Yeah, absolutely. Yeah.
Sorry, I joined one and then it pinged me back into this one for some reason.
Oh no, oh dear. I think Teams is, we were just saying earlier that we've all had very sort of glitchy experiences this morning. So let me try and pop you back into a room.
Thank you.
Thanks.
Let me see, why won't it let me pop you back in? That's odd, Claire. It says that you're in the breakout room. So I'm not sure why it's...
Oh.
Let me try and I'll put you into a different one and see whether maybe that works.
Oh, sorry. It looks like, yeah, my screen went funny. It looks like I can press resume and join the other one.
Okay.
Apologies.
Oh, perfect.
That was
sorry,
me.
That's fine. No worries. No worries.
Thanks.
And Natasha, let's try and pop you in. Apologies if there's any background noise. My my nephew is here. Oh, we've got the same issue with you, Natasha. It says that you should be in the room, but I'll pop you into a different one. I think you're on mute, Natasha.
Oh, sorry. Actually, hang on a moment. I can see I'm on hold in a room. Let me try and see if I can change. It just says on hold. I don't quite know how to.
Shall I try and pop
Just
you
hang on.
into
Let
a
me go
different-
to resume and let me see if that will work. And if I disappear, then if I don't, then you can try again. Thanks.
There
There
we
we
go.
go. I think that's worked. I think everyone's
Yeah, I think
gone off.
Bridget may. I'm not sure if Bridget's still here or she's popped off, but that's
I
fine.
think it looks like she's on hold, so I'm assuming she's in the. Oh, I have my
Well,
frozen. There we go.
yeah.
I'm back.
No, you were back. Brilliant.
Yes.
Okay. Super. Thank you so much. Well,
No
that's been
worries
really
at all.
fascinating, hasn't it? It's been good.
It's been really good.
Really,
I'm just
really
going to
good.
pop an announcement with the questions in, and then we're
Brilliant.
going to bring them back at.
Do, aren't we? One of the things that we do need to check is the Send Improvement Toolkit was signed off back in March, Thea. So
Yeah.
I think it's a bit worrying to say in November that it's not yet been published.
Yeah.
What Amanda and I were saying is we just wanted to put the RISE logo on the introductory piece and then it was done. So I think what I'd like us to say is that we'll send it out to everybody. Because I know Sam's put something in to say, let us know if you want it. But
Yeah.
I think I would have rather we just had said, look, it's available and we'll send it you, as opposed to it's not yet published, because it has been. I mean, we've been using it since, well, since we got it signed off. So I think if we could just say that actually, I mean, it's literally the logo on one piece that you know, that we just need to do, and then we could get that sent out. That would be really helpful if that's okay with you.
I'll message Sam and find out. But I'll also chase up on where that's gotten to, because I've not been involved in the improvement boards myself. But I will just chase up on that to find out where it's gone to, and see if we can get that published.
That would be
priority.
great. Yeah, because it needs to be on the website and everything else, really. So I'm not sure what the glitch has been on getting that on, and literally just getting the logo on the introductory piece. So if you wouldn't mind chasing that, that would be incredibly helpful.
Yeah, absolutely no problem at all. I'll speak to the team after this and find out what's happened. And if it's if we can send it out straight away, what I'll do is so I need to send a follow-up email after this with the evaluation form and everything, and so I can just attach it onto that email.
Would be great. I think
so
that would be super.
Yeah, so normally what we do is we have a team debrief after these sessions, so I'll raise it there, and yeah, I'll try and send it out ASAP. If not, I'll try and send it out at the end of this week. Well, by the end of this week, to everyone.
That would be brilliant. So it doesn't need the early learning one. It's just the 10 elements. There's 10 tools and an introductory piece.
Okay.
Not the early learning, I don't think.
Okay, not the early learning. No, okay, that's no problem.
All right, that would be wonderful. Thank you.
Excellent.
So really interesting. So again, you know, it's fascinating, isn't it? We could have actually done longer because people needed to talk more, didn't they?
Yeah.
Because actually to try and give it, you know, do justice to that incredible journey is quite tough in what's turned out to be a relatively short period of time, isn't it? 20 minutes is quite hard just to say it very succinctly. So
it's always the way, isn't it? There's never enough time, is there?
Whatever you give anybody, they always talk to the edge, and you're always just saying just a few more minutes, you know, and just trying to keep people on time. But that's absolutely fine.
Job of chairing, Deborah. You've been really brilliant.
Thank you. That's lovely of you to say, Thea. Thank you so much. So in terms of getting the feedback, are we going to ask each group to feedback, or are we asking them to put it in the chat? What do you think is best now?
I think probably we can ask them. We can ask them if they want to do either. But maybe if we ask them, you know, to put it in the chat, but if they feel comfortable, they can come off mute, just so that we're trying to get as much of that feedback as possible.
How many groups have we got?
We've got 6.
Okay, so if we could ask. We've got 6 groups. What would be great is to capture all 18 then.
Okay, yeah.
All 18 points, because we've asked them to do 3 each, haven't we?
Yeah.
So
Yeah.
if they could actually put those in the chat, then it'd be really good to actually pull that together as some of the learning.
Excellent. I will just send a message out to them just to say that we would like them to put the 3 elements into the chat when they come back, just as a reminder.
Yeah, but also can we talk through them?
Yeah.
Yeah, okay. Yeah, okay. Well, they've got another 5 minutes, so I'm hoping they're finding that really interesting.
Yeah, I'm sure they will be. They've been quite a quiet group today, actually, I thought.
But what I was also interested in is that whole element of partnership and joint responsibility for the partnership didn't come out as strongly as I thought it would from Hertfordshire and Kent a bit stronger, but not hugely strongly. And yet what we know is that is the core to the how. So they've talked about what they've done. What they've not done is highlighted the how as much as I thought they might do, which is interesting that they focus more on process and activity than some of the, I guess Hertfordshire did the enablers, didn't they? But yeah, just fascinating the different emphasis. But good, really good.
No, it's been really enjoyable. We've had great feedback so far.
Have we?
So I'm looking forward to just in the chat, but I'm looking forward to see what the feedback looks like when we actually send out that feedback form to everyone. But so far, aside from the fact that my Wi-Fi stopped working, it's all run quite smoothly, it seems.
Yeah, it's good.
Yeah, hopefully that wasn't too disruptive.
No, not at all. I didn't even notice.
Oh, okay, perfect. No, for some reason I work in the study, and for some reason the Wi-Fi just stopped working in there. So I've just relocated.
Oh no! Do you know, I find that sometimes, and you just think, why now? Which is what I was saying to you. I feel really lucky because mine's just stayed steady so far. So I thought, it's great.
Yeah. No, it's been really good. So I'm very pleased with that.
Good. No, it's good. And the thing is, I think what's really interesting with these things is how then it rolls out, isn't it? So although we might have had, 95 at the top people, it's what they then do with it. And do these then go on the website?
Yeah, they do. Yeah. So we'll put the slides and the recordings onto the website, and we'll so when the recording goes out, we'll then email the attendees just to let them know that the recording has been published as well.
And that they can share that if they want to.
Yeah, absolutely.
Yeah, super.
Yeah,
okay, so group session then next, group discussion, and then we've got that. Post evaluation form that they can do there and then, can't they, if they want to? Or you'll send it out. Brilliant. Okie dokie.
Excellent. I'll send out in just a minute. I'll send out a little reminder just that we'll close the rooms in 1 minute.
Yeah. Okay.
And then we'll bring them back in.
Bring them back in.
So I'm just going to go grab a quick glass of water. I'll be back.
Of course, you do that. Actually, I'll do the same. We'll both dash. It dry under the table first before we put the cover on, darling. Do you not think it matters?
Yeah, it was dry because it wasn't.
Okie.
Excellent. I'll just send a reminder that we'll close the breakout rooms in 1 minute.
Thank you.
Okay. Yes, sorry, I'm a little bit hoarse. I went down to Brighton this weekend and one of my friends had a showcase, so there was lots of cheering and shouting.
Oh, how gorgeous. Oh, that's lovely, isn't it?
It was really nice. Yeah. Really enjoyed it.
so good to do something very different at weekends, isn't it? And
yeah. So
yeah,
it was really
lovely.
nice.
Good, that's gorgeous. I ended up having a day. We were going to go and see friends yesterday for lunch up in Dunstable. We're down in Kent, but the weather was so bad. We just said, we all just agreed we couldn't do it. So I had one of those really gorgeous lazy days. Those unexpected days where you just tootle around and do those bits that you think, I can just do this and I can just do that. So great, what I call catching up day. So started the week thinking, whoa, yeah, really good. Really
but also
lovely.
the perfect weather for it as well, because it's the type of weather you think,
you
I don't want to go out at all.
I don't have to do anything at all. No, fantastic.
Because we were out all day in Brighton going, this is miserable.
Oh no, yeah. Oh, I'm sorry it was. That's hard, isn't it?
Right. Shall I bring people
Yeah,
back
that's lovely. Let's do the last bit. That would be super. Thanks, Thea.
There we go. And then we'll wrap up.
Yep.
It looks like people are coming back in now. It normally takes a few seconds.
Of course, absolutely. Welcome back to you all. I hope you found that interesting. I don't know about you, but I often find when I'm in those groups, the time whizzes by and actually you wanted at least 2, if not 3 times as long to be able to have those discussions. But I hope they've really triggered some interesting thoughts and reflections for you that you can take away with you. So what would be really helpful, there were 6 groups, and what would be really good is if you could please pop in the chat your 3 top things that you would be recommending or requesting in relation to getting your partnership arrangements to be stronger and impactful. So if you're happy to share those on the chat, that would be really helpful. And then we were going to ask whether or not people were interested in sharing that to the larger group now, please. So if some of you've got some thoughts about that, we'd really enjoy you just sharing those so the whole group can hear what you're sharing. So does anybody want to say about what they discussed in their group, please? And do please feel free to put your cameras back on now. I know most of you have had them off during the webinar, but if you're happy to put them back on now, it would be great to be able to see you. So we've got some things going on in the chat. Anybody happy to say? Jennifer, thank you. So I don't know if you get called Jenny, Jennifer or Jen, but I'll call you Jennifer as that's what's on your screen.
Thank you, that's fine. Yeah, it was just we had a discussion in our group about a couple of different things and about working at different levels to ensure that there's that evidence of joint working. But we also talked about sort of the longevity of the workforce. So when you've got people who are in post and are not moving posts quickly and rotating quickly, and you've got that sort of workforce development and retention, that in itself is kind of evidence that things must be working, because otherwise people would move on. And if you had a high turnover of staff, but then you've moved to being able to retain staff for longer, the suggestion, I suppose, would be that people are happier in post. And it also gives people time to build relationships and then to build trust with one another, which whilst at first we thought, oh, how would you evidence it? We thought that would be quite a good indicator that people were working well together.
Yeah. That's a really good thought, because we know, don't we, in different pockets of the partnership there's been some real challenges around retention. We've heard about it across the country in terms of health. We've also heard about it in terms of educational psychologists and SEND case officers doing the education, health and care plans. So I think that's a really good idea, retention rates improving and increasing. And I suppose also the recruitment becomes easier as the reputation gets more positive. So really helpful. Thank you. I'll come to Abby and then Vicky. Thank you.
Our group talked about how it's been very helpful to get really senior oversight of the work. And for example, having a director that has CYP education, social care in their portfolio, bring it all together has been really helpful. I've put in the chat, disco seems to be a theme, having availability of a disco. the visibility and the kind of local authority, education and health working together and visibly working together, visibly linking and sharing. And then finally, alignment of processes and data and infrastructure across the partnership as well, particularly around health and local authority information and data. That continues to be an asset where it's achieved and a challenge where people are still struggling through. And for, certainly for us, the whole GDPR minefield about how you get those agreements in place to be able to data share continues to be a challenge, I think.
Yeah. Okay,
I hope that was
super.
it,
Yeah.
group.
Yeah, really, really helpful. Thank you. And certainly, I think that whole idea of senior leadership oversight is so important, and the relationships across. So, is the chief executive of the council meeting with the chief executive of the integrated care board? Is the director of children's services meeting with the chief nurse or equivalent? And then is if you like, and I don't like to think of workforce in layers, but forgive me, but then is each layer of the sort of workforce having the similar sort of relationship opportunities across and being quite proactive in that. Really important point. Thank you. And we had a question about what a DISCO is. It's actually a designated social care officer. That came about in the recognition that in many areas social care was very separate from the SEND and education world. And the idea is that if you've got what is short form to DISCO in place, then actually that really strengthens those those children being represented, those who might be a child in need, child protection, children in care, etc., youth offending. And some places have really taken that opportunity and developed that, following on from some really wonderful work that the Council of Disabled Children did in developing that. And that is going to become a requirement for everybody to have one. So if you haven't got one now, then you will do in the near future. So I hope that's a helpful explanation of that role. And over to you, Vicky. Thank you.
Hi, thank you. Oh, we had some really interesting conversations, Deborah, and there was some fascinating things about relationships and about how when work really works well, that multi-agency kind of piece of work. And we did then sort of reflect a little bit that relationships do take work. We talk about, the importance of relationships. And then we sort of unpicked a little bit. One of the colleagues in the group was talking about, really having to think about those relationships. Maybe it's kind of part of who you are. You are that kind of person who loves making connections with people, but also thinking about how you promote your role and what you're doing, and also being resilient, keeping on knocking on doors. And we also touched on, the idea of knowing who to go to, because we don't always know, do we? And maybe our local offer websites are kind of really informative and have lots of information, but information does change quickly. So it's how we can maybe make sure that everybody knows who everybody is and who to go to when perhaps there is a bit of a challenge. But the main thing was maybe thinking about relationships in the same way as we think about communication frameworks, etc.
Yeah, really helpful. Yeah, really helpful, Vicky. Thank you, and thank you to all of you for that feedback. I mean, certainly I think that the work we're doing on improvement, and particularly looking at the improvement boards, one of the absolute key elements is around those relationships and the partnership functioning. And I suppose taking Hertfordshire's concept, which I think is so powerful, that SEND is everybody's business. And it's how much everybody is able to be really proactive, as opposed to waiting for somebody else to come to them and thinking, oh, well, I won't do anything because I'm not sure it's my job. It's how do we encourage everybody to see that it's their job to reach out and to make those partnerships and get those relationships, because we absolutely know that where those relationships are strong, then actually the service delivery, the improvement is achieved much more quickly, but in a much more sustainable way. So absolutely, really, really helpful. So thank you for that. And I hope you've had an opportunity to write up those ideas in the chat. And we're going to take some of that learning as well from you as a group, and use that with everybody's agreement, and hopefully you are, as part of the ongoing work we're doing in the SEND Improvement Board toolkit that I mentioned at the beginning, because I think it's really important that we take every opportunity to think about, well, what's everybody's experience at this moment in time as we move forward in these improvement journeys together. So we are delighted that in terms of the improvement journey, Kent, as Christine said at the beginning, has had its improvement notice lifted. So huge congratulations to Kent. Kent is now preparing for its SEND and alternative provision inspection under the new framework. And we are sending all our best wishes to Kent in that next part of their journey. And of course, Hertfordshire is on the other side of that with their two priority actions just about to be reviewed, and hopefully again their improvement notice lifted, given the extraordinary amount of work that they've done. So we'll look forward to hearing from that, and to be able to carry on producing some of the learning around improvement and sharing that learning as we go forward. So again, big thank you to all of you for all of your input today. I think we've heard some really, really powerful messages from both Hertfordshire and Kent, and we will make sure that all those slides are sent out to you so that you've got an opportunity to take those and do some learning from those yourselves. Please do reach out if there is anything else that you need to Thea or Tham in terms of if there's further thoughts that you might have, and any of you who are interested in doing any further work, so that we can link in there with you. With my other hat on, I am one of 2 local government association SEND improvement advisors. So again, very happy if there's any support or anything, either with my hat on as improvement board chair as part of the improvement work around improvement boards, and also as the LGA SEND improvement advisor, if that's very helpful to you. So just finally, it would be really incredibly helpful if you could take a few minutes just to do the post-evaluation form, please. You can get it through the QR code here, and it's always really helpful to know what's worked well, perhaps what's not worked so well, and any suggestions you've got for us to take forward, so that we can plan for the next webinars as Thea introduced at the very beginning. So we've got a couple of minutes for you to do that, if you're happy to do that. If you'd rather do it slightly later, then please do, and that means you get a couple of minutes back. But again, a very big thank you for your interest and your contributions today. And we wish you all very well in whichever part of your improvement journey you're on, and look forward to working with you and seeing some more of you in the not too distant future. Thank you.